there is actually still one area, Heather, where we are considered among the worst tonight in the country.
Terrible news, Scene, that is right. We're talking about infections and deaths among children and teenagers. And this, of course, should cause major concern considering more schools are reopening right now for in-person learning. Our chief investigative reporter, Morgan Lowe, spoke with the governor and the head of our state health department about this issue today. And Morgan, how did they respond?
Heather, it seems like I caught them off guard when I brought this up. This data comes from a recent study by the American Academy of Pediatrics. But when I asked the governor and the state's top doctor why more of our kids are getting sick, both of them struggled to come up with an answer. Arizona's children and teenagers are going back to school by the tens of thousands. This week and next week are set to be busy times as students and teachers adjust. It's happening now because 4 Arizona counties have met the benchmarks for reopening classes. Others, like Maricopa and Pima counties, are getting close. But this report from the American Academy of Pediatrics paints a stark portrait of how Arizona's children and teenagers are faring during the pandemic. 12 Arizona children and teens have died. Only Texas had more deaths. Arizona has the highest child and teen COVID hospitalization rate of the 21 states that released data. And Arizona had the second highest number of infected children, with 1,300 per 100,000. The overall rate, taking in every state, is 583 cases per 100,000. Do we have any idea why our numbers are so high? This afternoon, Governor Ducey tried to come up with an answer.
There's likely a number of reasons for it. The good news is, while there are still anomalies, and they are in the category unless they have an underlying health condition where they rebound pretty quickly.
Dr. Kara Christ said maybe it was because Arizona tests a lot of kids.
We also saw an increase recently because we've partnered with our school districts to try and get more testing of our families and their students.
It can't just be that we're testing more, because it seems like more of our kids are getting seriously ill.
It also has to do with how much of the data we're reporting. So we are putting out hospitalization by age category.
Yeah, so Dr. Christ seemed to say that we're collecting more data and we're testing more kids, but that doesn't really explain the why. It just says that we are finding the kids who are infected. It doesn't tell us why they're getting infected. Scene, Heather, back to you guys.
Morgan, I want to go back to the statistic that really jumped out in the middle of your story. 12 kids have died here in our state.
Yeah, 11 of them in the spring and the summer, and 1 just in the past 2 weeks.
So do these numbers, specifically the number of children infected, do they play any role in setting the benchmarks to reopen schools?
They don't. Those benchmarks are set by the number of positive cases sort of overall, not specifically the children who are getting infected. But we should probably note that the number of children who are infected is a small percentage of the overall infections in the state. In Arizona, children account for 12.2% of the coronavirus infections. Back to you.
All right, we know you'll keep looking for more answers and keep watching the numbers. Our chief investigative reporter, Morgan Lowe, thanks.